Hi, I am Dr. Amitabh Banerjee. I was an epidemiologist in the armed forces for over 2 decades. Presently, I am a professor in a medical college in Pune. Today, we'll be talking about HPV vaccine for prevention of cervical cancer. Cervical cancer is cancer of the lower part of the uterus, which is known as the cervix. So, there is a increased discussion on prevention by a vaccine, which is known as the HPV vaccine. The principle of prevention of cervical cancer by HPV vaccine is HPV stands for human papilloma virus. Human papilloma virus, there are about 100 serotypes of human papilloma virus, and there are two serotypes, serotype 16 and serotype 18, mostly serotype 16, which have been implicated as a risk factor for development of cervical cancer. This is based on some studies which found that women who had cervical cancer which develops in their 50s or 60s, they had higher infection with HPV virus, particularly 16 and 18 strain. And the principle of vaccination with HPV vaccine is that if you vaccinate girls, and now some countries are also recommending vaccinate boys also with this HPV vaccine, you will prevent the viral infection with the HPV virus, and which in the long run they is supposed to cause, is a risk factor rather, for cervical cancer. So they intend to vaccinate girls as young as 19 to 13 years, that is pre-adolescent girls, before initiation of sexual activity. Now here also there are cultural differences. This is they have adopted from the West, where the girls have been found to start sexual experiment in their teens, and this is sexually transmitted. HPV virus is sexually transmitted, and the idea is that if the girls are vaccinated, the HPV vaccine will prevent the infection with the HPV virus. However, in our country, the sexual activity starts in the 20s. Average age of sexual initiation is still much older. And secondly, there are incomplete evidence of whether HPV vaccine prevents actual cervical cancer, because whatever trials they have done so far has been, the endpoints have not been cervical cancer. Endpoints of the trials have been the precancerous lesions, which are C1N1 early precancerous lesions, which are supposed to, which may or may not progress to actual cancer. So there, as on today, there is incomplete evidence for efficacy of HPV against the endpoint of cervical cancer, because these lesions, these HPV virus caused lesions, which are just like warts in the genital area or in the perianal area, they are like warts which most of the time are self-limiting and may not progress to cancer. And the early precancerous, the vaccine has been found to prevent the early precancerous lesions, which is termed as C1N1 lesions, which mostly do not progress to cancer. And another thing is that if the government implements universal vaccination, if it includes HPV vaccine in the universal immunization program, how cost effective it will be, because everyone is not exposed to HPV virus equal amount, in equal measure. Those who are sexually promiscuous with multiple sexual partners, poor genital hygiene, repeated pregnancies, and unsafe sex, they are at higher risk. So whether people with safe sexual behavior, with avoiding multiple sexual partners, which is what is actually advocated not only for prevention of HPV virus, but also for other sexually transmitted diseases, HIV, unwanted pregnancy. That would be a more balanced approach. And here we have got incomplete evidence whether vaccinating in childhood would prevent cancer later in elder after 45, 50 years. There have been no studies so far because this vaccine, Gardasil vaccine, was licensed in 2006, and there were trials were in elderly women, not in teenage girls, and it was extrapolated to the teenage girls that it may protect the papilloma virus infection. Unfortunately, there have been some unfortunate experience in India of the trials in adolescent girls, pre-adolescent girls in 2009. Gates ICMR in collaboration with Gates Foundation and PATH undertook a trial of HPV vaccine in Andhra Pradesh and Gujarat. And there were some deaths during the trial in young girls. And there was a lot of hue and cry by the local population. ICMR and the other sponsors the trial tried to suppress the unfortunate adverse events, saying that it was due to coincidental rather, and not due to the vaccine, but because of the public outcry. And there was a joint parliamentary committee meeting, parliamentary committee report on it was investigated by a parliamentary committee on health and family welfare, and it implicated the sponsors of violating certain ethical principles. And in 2013, it tabled the report in both houses of parliament, saying that this should be investigated by a special investigating agency. That was in 2013. In almost a decade is there had been no special investigation, and now there is advocacy for introducing this in the HPV vaccine, which has not been tested fully. It is only certain surrogate endpoints have been taken as vaccine efficacy, not because the cervical cancer takes more than 2 to 3 decades. So no trial has been for such long. Only report have been for 4 to 5 years. The follow-up after vaccination has been 4 to 5 years. And that is too short a period. Surrogate interim measures like clearance of human papillomavirus was used, or the clearance of early precancer, very early precancerous lesions, which do not necessarily progress to cancer. And a peer-reviewed paper published in one of the leading journals, anybody who wants to advocate this vaccine for the child who is not of an age to give informed consent, the parents, all parents who intend to give this vaccine for the child should read the paper. I will just read out the title of the paper. Will HPV vaccine prevent cervical cancer? This is the title of the paper. Will HPV vaccine prevent cervical cancer? This has been published in Journal of Royal Society of Medicine, 21st January 2020 by Clara P. Rees. Author surname is R-E-E-S, Rees et al. Volume 113, issue number 2. So this very clearly, it brings out this paper has been published without any pharmaceutical sponsors, without any conflict of interest. This paper has been published in a journal which has asked certain questions, and it concludes that there is no firm evidence because there are 100 serotypes and vaccine is only against 2 serotypes. So we do not know whether other serotypes will proliferate. And secondly, it says that the cancer screening has to continue, and there have been studies which shows that if cancer screening is in place for women over 40 years or 35 years, yearly cancer screening with pap smear, vaccine does not give any extra protection. There is no evidence to say that vaccine will give some extra protection against cervical cancer. So this paper is written in a very simple language with good evidence and in a high impact factor journal. So they should, in fact, I have got a number of gynecologist friends, and among those gynecologist friends, some have even circulated this paper to the cancer specialist, gynecology cancer specialist. And earlier when I discussed with them, they were very, very convinced. In fact, one of them gave a TV interview also advocating HPV vaccine. He's a good friend of mine. When I sent him this paper and my commentary on the paper, I asked him to read that. So he was convinced that there is no enough evidence, and he said that yes, it should not be included in the universal immunization program. It can be kept for those who want to use it on a voluntary basis, and the taxpayers' money should not be invested in it, which should be better invested in screening for cancer, because there is no full protection. Because when you are investing a large amount of money in any program, you have to see the cost benefit, and of course the long-term harms and risks are also not known. In fact, there have been number of lawsuits against this Gardasil vaccine or HPV vaccine are going on in the United States. So there have been some adverse events reported, and the benefit is uncertain. So this is all, we have to make an informed decision. We cannot blindly, because clinicians and even my gynecologist friend with whom I interacted before I circulated this paper and discussed it, all of them are very convinced that it is a good thing, because it is good if there is a vaccine which can prevent cancer, but the evidence has to be very strong for mass investment, for a large-scale investment of money and resources, and neglecting the other protective measures like safe sex, like genital hygiene, and screening at a certain age. So that this all I have to say. So the decision has to be informed, and